Hi, Swapnamay. One moment. Good evening. Good evening. So we'll start. Tips for university exams. उत्कर्ष सब important topics revise कर लो. हाँ, important topics तो आपको पता ही है. Revise them. Draw diagrams. Diagrams practice करो. And see the time. Adjust your time. See to it that you complete your entire paper. ठीक है. पहले LAQ को attempt करिए. So finish the LAQ first. And then you attempt the rest of the questions. Write all the questions, sub questions of that Roman number on the same page. Like question number 3, A, B, C, D, सब एक पेज पे लिखिए, मतलब एक साथ लिखिए. Then you go to the next question. Okay, fine. Suppose by chance if you're not able to recollect anything, so leave it. At the end, try to recollect. Do not waste time. Okay, completing paper is a must. And first attempt the LAQ. LAQ पहले खत्म करो. अगर SAQ है which is like an LAQ, तो you know make it short and write it. 4.5 मिल सकते हैं. Yes, 5 में 4.5 मिल सकते हैं. Yes, वर्मा मिल सकते हैं. Good evening to all of you. ठीक है. And एक बार theory अच्छा हो जाता है ना, so your practicals automatically will be good. बच्चों, practical is a reflection of theory. सब थ्योरी प्रैक्टिकल्स में पूछते हैं. ओनली आइडेंटिफिकेशन इज व्हाट यू नीड टू. थ्योरी के बाद गो टू योर रेस्पेक्टिव कॉलेज, रिवाइज द सॉफ्ट पार्ट्स, सी द डिसेक्शन वीडियोस एंड अकॉर्डिंगली आंसर. ओके, चलो. सो लेट अस बिगिन विद दिस प्रैक्टिकल सेशन ऑफ फरे, स्पेशली मेड दिस ईयर फॉर यू. अच्छा, वेरी गुड. दोनों पेपर अच्छा गया. जितने अभी बच्चों का पेपर हो गया, पेपर अच्छा गया है. And trust me, you've all been studying very well. बहुत मेहनत की आपने. The credit goes to all of you. And जिनका पेपर बाकी है वो भी अच्छा ही जाएगा. Don't worry. हाँ, paper will be all good. चलो, so starting with the first slide, huh? You just try to identify what I'm focusing, what I'm pointing. What is this structure? Can anyone tell me what is this structure? This structure. Don't see the rest of the thing. Just see this. ये क्या लग रहा है आपको? I can't zoom it. इससे ज़्यादा zoom नहीं कर सकता हूँ. So just try to understand this. ठीक है वर्मा. ठीक है, that's fine. That's fine. Don't see anything else. Just tell me what is this? Something which looks like this, and something. What's that? हाँ, cartilage. ये cartilage है. I'm asking you, what is this? What is this? This and this. Good evening. This is the nucleus. ये nucleus है. And this is the thin rim of cytoplasm. ये cytoplasm का rim है. This is the thin rim of cytoplasm around the periphery. That's a nucleus. What do you think is that? That's an adipose tissue. Very good. ये adipose tissue ऐसे दिखता है. What is this appearance known as? Any guesses? What is this appearance known as? It looks like a ring. Ring का stone ऊपर है, and this is the periphery of the ring. It is known as the signet ring appearance. Signet ring appearance. Fine. Fat droplet यहाँ पे होगा. The fat droplet gets dissolved during staining. It looks empty. Very good. It's a signet ring appearance. That's a adipose site, adipose tissue. ये याद रखना, ये पूछते हैं एग्जाम्स में. Fine. Okay, now we start with the first slide. Identify this slide. Whatever you can identify, you just try to think and answer. देखो short note भी आता है ना इस पे, तो you have to draw one good diagram. 2-3 points लिखना है. That will suffice. Okay. What is this? What do you think is this? Chalo, start. You can guess this. You can see a covering here. You can see cells here. And the cells are found in a group. Very good. Excellent. So these are the chondrocytes. पहले मैं नहीं बोल रहा हूँ. पहले आप सोचिए. Just try to identify. then I'll tell you. ठीक है? So this is a perichondrium. Perichondrium is present. The chondrocytes are present in groups. What do you call that as? इसको क्या बोलते हैं? Cell nest. Cell nest. So chondrocytes are present in group. You can see this group of chondrocytes. So इसको बोलते हैं cell nest. There are small cartilages. There are small chondrocytes at the periphery, and जैसे अपन center में आते हैं, the chondrocyte becomes large in size. Now, what is this surrounding the chondrocytes? That's a matrix. This is known as territorial matrix, which is dark, and ये बाकी का है वो interterritorial matrix होता है. Fine. So chondrocytes are found in a group. Tell me the sites of hyaline cartilage. Hyaline cartilage is the most easiest slide that you can get in the exam. Very easy to identify. अगर short note भी आता है hyaline cartilage पे, तो just write this 4-5 points, draw a good diagram, and sites of hyaline cartilage. One is the trachea, the second is thyroid cartilage, cricoid cartilage. Okay, ये सब hyaline costal cartilage. These are all examples of hyaline cartilage. Fine. I'm just telling you how to identify the slide. हाँ, कैसे slide को identify करते हैं. Fine. Very good. Coming to this, identify this now. What do you think is this? Nasal septum. Yes, nasal septum bhi hai, Shreya. Very good. Fine. Akshat, very good. What is this, students? Epiphyseal plate. Yes. Okay. Fine. You all know this. Abhi ye identify kar lo. This, you can see chondrocytes. Perichondrium is present. You can see largest size of chondrocytes. See the size of chondrocytes. It's the largest in size. थोड़ा सा fine adjustment घुमाओगे ना, you'll move the fine adjustment, you'll get fibers here. हाँ, ऐसे shiny fibers दिखेंगे बीच में. These are elastic fibers. Okay, so you get shiny fibers in between. These are elastic fibers. Elastic fibers are good. You'll definitely pass, bacha. Okay, so elastic fibers are single branched होते हैं, single होते हैं, shine करते हैं. So this is how you identify elastic cartilage. Chondrocytes are the largest in size. सबसे बड़े chondrocytes are in elastic cartilage. Yes, you can listen to this lecture. Perichondrium is present. Sites of elastic cartilage. Epiglottis is an elastic cartilage. Pinna is an example of elastic cartilage. Fine. Very good. Identify this now. Most of the times ये slide नहीं होता है कॉलेज में, but जिनके कॉलेज में है ये slides, you can see large bundles of fibers. ये देख रहे हो, this bundles of collagen fibers, and you can see the smallest size of chondrocytes. ये जो chondrocytes दिख रहा है, this is the smallest in size. The chondrocytes are very small, and there are plenty of collagen fibers. This is a cartilage जिसमें perichondrium absent होता है. Perichondrium is absent. This is white fibro cartilage. White fibro. Hi Samaik. White fibro cartilage. Good evening. ठीक है? हाँ. Fibro cartilage. So smallest size of chondrocytes, the bundles of collagen fibers होते हैं. Sites. Tendon में है ना बच्चा, निशांत. Tendon में you get fibroblast. Collagen fibers with fibroblast. And fibroblast है ना, fibroblast का ये ऐसे होगा. ये दिख रहा है. This would be a tendon. Yeah, इसमें देखो. You can see this nucleus is like a hair shaped nucleus होता है. So collagen fibers with fibroblast का nucleus is hair like. So that would be a tendon. Now this you can actually see the chondrocytes here. So this is a fibrocartilage and this would be a tendon. ये tendon आप ले सकते हो. Fine. So what is the difference between a white fibrocartilage and tendon? टेंडन में फाइब्रोब्लास्ट होता है. फाइब्रोब्लास्ट का न्यूक्लियस इज वेरी थिन, वेरी लाइक माइन्यूट न्यूक्लियस. इट्स लाइक अ हेयर. हाँ, इसमें द न्यूक्लियस इज स्मॉल इन साइज, reduced in shape. Okay, examples of white fibro: intervertebral disc, articular disc, menisci. जहाँ पे stress strain होगा, you get white fibro cartilage. Fine. Okay, this is the easiest slide. अगर ये slide आता है तो it is the easiest. You are very lucky. So इसको क्या लिखोगे? इस slide को क्या लिखोगे आप? This is the ground section of a bone. Ground section मतलब bone को लेते हैं and it is grounded, मतलब ऐसे घिसते हैं against a rough surface till you get a fine section. So this is what we call as a ground section of bone. इसमें you'll be getting this What are these? Haversian canals, these are the Volkmann canals. फिर lamellae, lacunae, ये सब आपको पता है. What are the cells of the bones? वो आपको याद रखना है. Osteoblast, osteoclast, osteocyte, osteoprogenitor cell. ठीक है, osteoprogenitor cell is the one which is going to form. What is the function of osteoclast? It is a bone resorbing cells. जो dead cells होते हैं उनको निकाल देते हैं. हाँ, fine. Osteoclast. Fine. So bone का slide is very easy. ये तो and इसको pencil में draw करना है. You have to draw this in pencil. Ground section of a bone. Ground section of a bone. इसका नाम है. Okay, students, come on. Can you identify this slide now? This is a very important slide. बहुत important है. And remember, general histology के slides होंगे, systemic histology के slides होंगे. चलो, identify this slide. What do you think is this? So connective tissue है बीच में. This is all connective tissue. What is this slide? Any guesses? This is a section, transverse section. Okay, transverse section है. इसमें है ना, it is a section like this, and the nucleus is at the periphery. Nucleus is at the periphery. What do you? This is muscle. ये muscle है, pancreas नहीं है, श्रेया. This is muscle. This is skeletal muscle. Skeletal muscle. So this is TS of a skeletal muscle. Nucleus is at the periphery. इतना clear नहीं दिख रहा है ये, but you can see the nucleus here. I can't zoom it. Zoom नहीं कर सकता हूँ मैं. You can see this TS of the fiber, muscle fibers. The nucleus is placed at the periphery. Okay, so this is a skeletal muscle. Skeletal होगा, cardiac होगा या smooth होगा. So skeletal is easy to identify. What is this muscle? This is LS. You can see this. You can see this. You can see this. What is this? You can see this. Yes? Any guesses? बोलो बोलो बोलो. Try to guess this. This is branching. Branching है. Branching है. नहीं, ये branching है ना बच्चे. Nishant, branching is very clearly seen. So this has to be cardiac muscle. Cardiac muscle. Longitudinal muscle fibers are seen. Branching pattern is seen. फिर उसमें और एडिशनल आप लिख सकते हो इंटरकैलेटेड डिस्क, सिंगल न्यूक्लियस, न्यूक्लियस इज इन द सेंटर. सो दिस इज गोइंग टू बी अ कार्डियक मसल. कार्डियक मसल. स्मूथ मसल का स्लाइड सेपरेट स्लाइड नहीं होगा. स्मूथ मसल विल बी ऑफ सम ऑर्गन. ऑर्गन, हाँ, लाइक GIT वगैरह में स्मूथ मसल होगा. हाँ, यू गेट स्पिंडल शेप्ड सेल्स. न्यूक्लियस इज इन द सेंटर. स्पिंडल शेप्ड सेल ऑफ स्मूथ मसल. फाइन. सो वेरी इंपॉर्टेंट इज स्केलेटल मसल एंड कार्डियक मसल. ये दो स्लाइड्स यू हैव टू नो. फाइन. Okay. Yes. Any guesses? What is this slide? Another very very important slide. अगर ये slide आता भी है ना, so there is, it's very good. There's a lot to answer. बहुत answer कर सकते हो आप. What is this? Any guesses? बोलो. What do you think is this? चलो guess करो, then I'll tell you. Come on, students. What do you think is this? What do you think is this? अगर मैं दूसरा स्लाइड दिखाऊं तो it is going to be very easy. हाँ, अभी बोलो. ट्रेकिया नहीं है रिचा. ट्रेकिया नहीं है. ट्रेकिया में कार्टिलेज दिखेगा. कार्टिलेज दिखना चाहिए. Only then you can see it, tell it as ट्रेकिया. अब ये देखो ना, ये बहुत क्लियर है. This is very clear. This is very clear. नहीं, not cornea. No, not cornea. ये ऐसे slide with a lumen होता है ना. Slide with a lumen. Which are the slides with a lumen? बोल सकते हो. Slide with a lumen. हाँ. Which are the slides with lumen? एक है blood vessel. Blood vessel. Artery, vein. Blood vessel. Slide with a lumen. Ureter. Slide with a lumen. Vas deferens. Fallopian tubes. So these are the slides with a lumen. Lumen मतलब space in between. हाँ, तो वैसे identify करना है. Okay. So now this is the artery. This is the artery. अगर ये आता है तो it's very very nice. इसमें आंसर करने के लिए बहुत होता है. What are the 3 tunics of an artery? बोल सकते हो. 3 tunics of an artery. Yes. हाँ, very good, very good. What are the 3 tunics of an artery? One is tunica intima, tunica intima, tunica media, and tunica adventitia. Tunica intima, tunica media, tunica adventitia. Tunica intima is made up of three parts. One is endothelium, then the subendothelial connective tissue, and the third one is the internal elastic lamina. Internal elastic lamina. Fine. So this you should know. ये by default पूछेंगे. What are the three tunics of an artery? Tunica intima, tunica media, tunica adventitia. Tunica intima के three parts होता है, endothelium, subendothelial connective tissue and internal elastic lamina. Fine. Now what is endothelium? Can anyone tell me what is endothelium? It is the simple squamous epithelium which lines the blood vessels. And a simple squamous epithelium जो blood vessels को line करेगा, that is endothelium. Fine. So now how do you differentiate between a muscular artery and an elastic artery? This is another very important question which is asked. Muscular artery and elastic artery. So tunica media, ये जो tunica media है ना, tunica media of a muscular artery will contain smooth muscles. Smooth muscles of an elastic artery will contain elastic fibers. Elastic fibers, right? So tunica media of a muscular artery will contain smooth muscles, of elastic artery will contain elastic fibers, more amount of elastic fibers. Now this internal elastic lamina is made up of elastic fibers. ये elastic fibers का बना हुआ आता है, हाँ? This internal elastic lamina is prominent in which arteries? बोल सकते हो? Internal elastic lamina is a characteristic of what? चलो answer this. ये हमेशा पूछता है, ये MCQs में भी आता है. Internal elastic lamina is made up of elastic fibers. Tunica media of a elastic artery contains elastic fibers. तो ये differentiate नहीं होता. It is there, but it cannot be differentiated. Whereas in a muscular artery, tunica media में smooth muscles होते हैं. And this internal elastic lamina, which is made up of elastic fibers, stands out very clearly in a muscular artery. Sargun, वो है ना bones में बोलता हूँ. Bones का है ना एक hard parts made easy series है मेरा on PW Medit. हाँ, I'll tell you that. मैं बोलता हूँ. ठीक है. Fine है बच्चों, clear? So internal elastic lamina is a characteristic of which artery? Muscular artery. Doesn't mean it is absent in elastic artery. Elastic artery may भी होता है, but it is not differentiated, cannot be differentiated. समझ में आया ये सबको? Is this clear to all of you? हाँ, you can see this. इसमें देखो, इसमें बहुत prominent है ये. You can see this line. That's the internal elastic lamina. Fine. It is made up of elastic fibers. It stands out very clearly. So example of elastic artery, aorta. Big arteries, these are elastic artery. Example of muscular arteries are small artery, femoral artery, then brachial artery, popliteal artery. Fine. SVC is a vein, bacha. Vein and artery में difference क्या होगा? Vein will have a large lumen and the walls will be small in size. Fine. What does the tunica adventitia contain? Tunica adventitia will contain vasa, vasorum. These are blood vessels supplying the blood vessels and the nerves supplying the blood vessels. Nervi vasorum. So tunica intima के ये layers है. Tunica media smooth muscles या elastic fibers होता है depending on what artery it is. And tunica adventitia में there will be blood vessels supplying blood vessels, and nerves supplying the blood vessels. Hi Sudeep Angadi. Very good. Good. पेपर अच्छा जाता है तो बहुत अच्छा कॉन्फिडेंस भी मिल जाता है. हाँ, एक्सटर्नल इलास्टिक लामिना इज आउटसाइड. हाँ, एक्सटर्नल इलास्टिक लामिना इज बिटवीन मीडिया एंड एडवेंटिशिया. वो बाहर होता है. रिचा, दैट इज आउटसाइड. द मेन थिंग इज द इंटरनल इलास्टिक लामिना. फाइन. ओके, सबका पेपर अच्छा जाएगा, डोंट वरी. फाइन, क्लियर विद द ब्लड वेसल्स के 3 लेयर्स वगैरह वो सब याद रखना. नाउ कमिंग टू दिस स्लाइड, टेल मी व्हाट इज दिस स्लाइड एंड व्हाट इज दिस स्लाइड? एनी गेसेस? These are very standard slides. ये तो आनी ही चाहिए. This you have to know. Any guesses? चलो बच्चों बोलो. Okay, Karthik. Fine. What is this slide? Okay, Yatharth. दैट्स फाइन, दैट्स फाइन. सी पेपर 1 पेपर 2 होता है ना, वो इट इज बैलेंस्ड. कभी कभी पेपर 1 इज इजी, पेपर 2 इज डिफिकल्ट, पेपर 2 इज इजी, पेपर 1 इज डिफिकल्ट, तो वो बैलेंस्ड होता है. सो डोंट वरी. हाँ, दिस इज नॉट एल्वियलस बच्चे, ये एल्वियलस नहीं है. एल्वियलस में बड़े बड़े एयर स्पेसेस होते हैं. दीज आर स्मॉल स्मॉल थिंग दैट यू आर सीइंग. एल्वियलस में बड़े बड़े एयर स्पेसेस होते हैं. सो दिस नॉट एल्वियलस. एनीथिंग एल्स? और कुछ गेस कर सकते हो? यस रीचा, कार्तिक. यस कार्तिक बोलो, कैन यू गेस एनीथिंग एल्स? लंग्स में द एयर कैविटीज आर बिग एंड एपिथेलियम इज सिंपल स्क्वामस. बहुत एविडेंट है वो. दिस इज नॉट लंग, दिस इज नॉट एल्वियलस. नो. इसके साथ कंपेयर करिए, इसके साथ कंपेयर करिए. यू गेट कनेक्टिव टिश्यू. देखो कनेक्टिव टिश्यू बहुत है, कनेक्टिव टिश्यू बहुत है. दिस इज वन लोब, दिस इज अनदर लोब, दिस इज थर्ड लोब विच इज डिवाइडेड बाय कनेक्टिव टिश्यू. पोर्टल ट्रायड नहीं है बच्चे, ये पोर्टल ट्रायड नहीं है. पोर्टल ट्रायड में लीवर दिखेगा ना, लीवर, लीवर यू विल बी एबल टू सी. दिस इज सलाइवरी ग्लैंड. वेरी गुड श्रेया. दिस इज सलाइवरी ग्लैंड. ये सलाइवरी ग्लैंड है. बोलता हूँ आई टेल यू. हाँ, दिस इज अ सलाइवरी ग्लैंड. सो व्हाट इज द फंक्शनल यूनिट ऑफ अ सलाइवरी ग्लैंड? एसिनस. एसिनस. अब एसिनस आर ऑफ टू टाइप्स. हाँ, जिसके भी डाउट्स है ना, बाद में डिस्कस करते हैं. आई विल फर्स्ट फिनिश दिस. Acinus are of two types. One is serous acinus, one is mucus acinus. Serous acinus, mucus acinus. ये जो empty दिखता ना slide, the slide which looks empty, this is of a mucus acinus. ये ना, ये दिख रहा है empty, empty, empty. That is of mucus acinus. Why? Because mucus है ना, mucus, it is dissolved during staining. जो mucus secretions होता है, that is dissolved during staining. So mucus acinus का slide looks pale, pale. What is this? Look at this colorful acinus. This is a serous acinus. It is colorful because of presence of zymogen granules. उसके अंदर zymogen granules होते हैं. So serous acinus is always a colorful slide, whereas mucus acinus is a pale staining slide. याद रखोगे? Okay. And sometimes you get serous and mucus together. That is what we call as a mixed salivary gland. Mixed salivary gland. Look, this is a mixed salivary gland. ये जो empty है, empty, these are all mucus acinus. And ये जो colorful है, these are serous acinus. So serous and mucus acinus. So this is a mixed salivary gland. You should be able to identify this. You have to draw an acinus. Acinus को draw करना है. What is an acinus? It's a group of secretory cells enclosing a lumen. Group of secretory cells enclosing a lumen. That is the definition of an acinus. Fine. How do you differentiate a serous from a mucus acinus? बोल सकते हो serous from a mucus acinus. So serous mucus acinus में the cells are columnar. ऐसे columnar cells होते हैं. Serous acinus में the cells are cuboidal. Cuboidal cells. The nucleus is rounded in the center of the cell. Rounded nucleus होता है, center में होता है. इसका nucleus flat होता है at the base of the cell. This is mucus acinus and this is serous acinus. Tell me example of and ये जो serous acinus है ना, इसमें there is basal basophilic stain, basal basophilic and apical eosinophilic. Apical eosinophilia होता है. This is known as zymogen granules. Zymogen granules. Basal basophilia, apical eosinophilia. So that is zymogen granules. फिर दूसरा सवाल होगा, टेल मी द एग्जांपल ऑफ अ सीरस सलाइवरी ग्लैंड. यस, सीरस सलाइवरी ग्लैंड एंड म्यूकस सलाइवरी ग्लैंड का एग्जांपल. सीरस सलाइवरी ग्लैंड इज पैरोटिड, म्यूकस सलाइवरी ग्लैंड इज सबलिंगुअल एंड मिक्स सलाइवरी ग्लैंड इज सबमैंडिबुलर. फाइन. ओके, गुड. ये भी है, देखो इसमें क्लियर है, इसमें क्लियर है. Look, this is a serous one, this is a mucus one. Serous mucus. And this is the duct. ये duct है. Fine. Can you identify this slide? Yes, बच्चों, ये slide identify कर सकते हो? Difficult is histology. बच्चों, हिस्टो के spots जो होते हैं ना, 10 marks के spot, that is the difficult thing. अगर 10 में 7 भी मिल जाते हैं ना, your total goes very high. Students lose marks in histology spots. Slide for discussion कैसे है? The exam, suppose if you do not identify the slide, the examiner will give you a hint. थोड़ा सा हिंट देंगे एंड दे विल हेल्प यू टू आइडेंटिफाई द स्लाइड. आपने डायग्राम ड्रॉ किया तो वैसे मार्क्स मिल जाते हैं. डिफिकल्टी स्पॉट. टंग नहीं है बच्चे ये रीचा. रीचा इट्स नॉट टंग. इट्स नॉट टंग. टंग टंग विद पैपिले नहीं है. टंग में है ना यू विल गेट प्लेंटी ऑफ मसल्स. स्केलेटल मसल्स मिलेंगे टंग में. प्लेंटी ऑफ स्केलेटल मसल्स इन द टंग. ये मसल नहीं दिखता है. दिस इज ऑल कनेक्टिव टिश्यू. दिस इज ऑल कनेक्टिव टिश्यू एंड दिस इज द एपिथेलियम. दैट इज एपिथेलियम. एपिथेलियम इज स्ट्रैटिफाइड स्क्वैमस केराटिनाइज्ड एपिथेलियम. स्ट्रैटिफाइड स्क्वैमस केराटिनाइज्ड एपिथेलियम. यहाँ पे अगर मसल्स दिखते हैं, मसल्स स्केलेटल मसल्स, फिर वो टंग होता. फिर वो टंग होता. इसोफेगस भी नहीं है बच्चे. इसोफेगस में ग्लैंड दिखते हैं. ग्लैंड्स. यू सी ग्लैंड्स इन द सबम्यूकोसा इन इसोफेगस. क्या हो सकता है ये? क्या हो सकता है? यस देविन, क्या हो सकता है ये? अ थिक लेयर ऑफ एपिथेलियम एंड दिस इज कनेक्टिव टिश्यू. पैपिलरी लेयर, रेटिकुलर लेयर. अभी बोलो, आई हैव गिवन यू अ हिंट. एक पैपिलरी लेयर होता है, एक रेटिकुलर लेयर होता है. व्हाट इज दैट? This is thick skin. Thick skin. Thick skin. थोड़ा सा different होगा in what you have seen in your college. That is thick skin. And you can see this. ये तो बहुत easy है. If you get this slide, nothing like it. And spots में भी some spots will be very easy. Some spots will be difficult. पांच spots होंगे easy and difficult. So passing is easy, but scoring is difficult. Okay, what is this skin? See, hair follicles है. ये hair follicles है. This is going to be the thin skin. ओके ये थिन स्किन है. सो थिक स्किन एंड थिन स्किन. लेयर्स ऑफ द स्किन आपको आना चाहिए. हाँ, द वेरियस स्ट्रेटम, एपिडर्मिस, डर्मिस. डर्मिस के 2 लेयर्स, पैपिलरी लेयर, रेटिकुलर लेयर. हाँ, गुड गुड. फाइन, गुड क्रिश, गुड, फाइन. नाउ आइडेंटिफाई दिस स्लाइड. अब देखो, एक स्लाइड तो लिम्फोइड टिश्यू का होगा ही. लिम्फोइड टिश्यू, वन स्लाइड इज ऑलवेज गोइंग टू बी देयर. One slide of lymphoid tissue is 100% going to be there. So how do I identify a lymphoid tissue? How do I identify lymphoid tissue? The moment I get this goal, ये कौन है? What do you call this goal? इसको क्या बोलते हैं? What do you call this rounded thing as? That's okay, that's okay. See, गलती यहाँ पे करो, that's okay. हाँ, final exams में गलती नहीं करना है. You learn from your mistakes only, है ना बच्चों? So that's fine, that's fine. ये क्या है? एक मिनट. दिस इज अ स्लाइड ऑफ लिम्फोइड टिश्यू 100%. यस, दिस इज द स्लाइड ऑफ लिम्फोइड टिश्यू. हाउ डू आई नो दिस? बिकॉज ऑफ द लिम्फोइड फॉलिकल्स. ये जो गोल दिख रहा है, दैट इज लिम्फोइड फॉलिकल. फाइन. नाउ यू टेल मी व्हाट इज दिस. ये है कैप्सूल. दिस इज द कैप्सूल. फाइन. व्हाट इज दिस पार्ट? दिस इज द कॉर्टेक्स. What is this part? This is the medulla. Cortex and medulla. Medulla में medullary cords होते हैं, medullary sinuses होते हैं, cortex में lymphoid follicles होते हैं. This is a capsule and you get a space, बच्चों, you get a space below the capsule and this is what we call as a subcapsular sinus. बोल सकते हो? Subcapsular sinus. Spleen नहीं है ये बच्चे, spleen नहीं है मानस. It is not spleen मानस. It is not spleen. नहीं मानस, इट्स नॉट स्प्लीन. कैप्सूल, कैप्सूल के नीचे स्पेस होता है जिसका नाम है सब कैप्सुलर साइनस व्हिच हेल्प्स इन फिल्ट्रेशन ऑफ लिम्फ. दैट्स लिम्फ नोड. दैट्स लिम्फ नोड. लिम्फ नोड है वो, लिम्फ नोड मानस, इट्स लिम्फ नोड. फाइन. यू गेट कॉर्टेक्स में यू गेट लिम्फोइड फॉलिकल्स. दिस इज द मेडुला. मेडुला में यू गेट मेडुलरी कॉर्ड्स, मेडुलरी साइनसेस. Fine. This is a lymph node, bache. I'll show you the other slides. You will understand this. I'll show you the other slides. Fine. Now look at this. This is a slide of lymphoid tissue. देखो बच्चों, एक मिनट. lymphoid tissue अपने पास 4 है. हाँ, lymphoid tissue. We have got 4 slides of lymphoid tissue. Lymphoid tissue. We have got 4 slides. इसमें ना lymphoid follicles. Lymphoid follicles. If they are present, if they are absent. अगर lymphoid follicles absent है, what do you हाँ बोलता निशांत बोलो. wait. अगर lymphoid follicle absent है, so that is lymphoid follicles absent, so that is thymus. That is thymus. Fine. Lymphoid follicles अगर absent है, तो that slide is going to be thymus. Now, how do we identify the thymus? Thymus में क्या होगा? लोब्यूल्स होंगे, थाइमिक लोब्यूल्स होंगे. Each lobule will have cortex and medulla. Each lobule will have cortex and medulla में होगा Hassel's corpuscles. Hassel's corpuscles. ठीक है. तो the moment I see a slide जिसमें lymphoid follicles are not there, but the slide is basophilic. Slide is basophilic. I know it is lymphoid tissue, but lymphoid follicles are absent है. So I, at the back of my mind, I know this can be thymus. How do I differentiate then? How do I come to a conclusion? तो ऐसे thymic lobules होंगे. Thymic lobules होंगे. This is one lobule, this is second lobule. ये देखो connective tissue दिख रहा है, connective tissue. So ये thymic lobules होते हैं. Each lobule will have an outer cortex and inner medulla. हाँ, see this is a lobule. ये lobule है. बाहर की तरफ cortex है, अंदर की तरफ medulla है. And in the medulla, what do we have? In the medulla, we have this Hassel's corpuscle. Hassel's corpuscle. So Hassel's corpuscle is a degenerated epithelial cell. ये आपको आंसर करना है. What is a Hassel's corpuscle? It is a degenerated epithelial cell. Fine है बच्चों. तो lymphoid follicle अगर absent है, it is going to be thymus. Then you have to then come to a conclusion of thymus. Fine. अगर lymphoid follicle present है, suppose if a lymphoid follicle is present, lymphoid follicles are present, then it can be either lymph node, tonsil, or spleen. Fine, lymph node, tonsil, or spleen. अगर मुझे lymph node focus करना है, suppose if I want you to identify it as a lymph node, so I have to show you a capsule, I have to show you the subcapsular sinus. ये I have to show. So lymph node में क्या होगा? Capsule होगा. Then there's going to be a subcapsular sinus. फिर cortex होता है and medulla होगा. Cortex and medulla होगा. Fine. Tonsil. What is the characteristic of tonsil? Crypts. Crypts होते हैं. And the epithelium is stratified squamous non-keratinized. Stratified squamous non-keratinized epithelium होगा. Fine. And spleen में, what do you get in the spleen? Spleen में होगा red pulp, red and white pulp, and in the white pulp you've got an eccentric arteriole. Eccentric arteriole in the white pulp. Incomplete septa in the thymus. That's fine. That's fine. बस ये टेबल याद रखना. If you remember this table, your lymphoid tissue is very easy to identify. ठीक है बच्चों. तो पहले तो I have to see lymphoid follicles. Lymphoid follicles अगर absent है तो 100% thymus है. How do I come to a full conclusion? तो thymic lobules होंगे, lobule में cortex होगा, medulla में Hassel's corpuscle होगा. Now अगर lymphoid follicles present है, it can be lymph node, spleen, tonsil. How do I identify lymph node? Capsule के नीचे space, subcapsular sinus, cortex, medulla, lymphoid follicles. Tonsil, how do I know it's a tonsil? Look at this. ये आप देख रहे हो. What is this known as? What is this? इसको क्या बोलते हो? This is a crypt. This is a crypt. That is how a tonsil looks. Crypts होता है. Not a very good slide, but crypts होता है tonsils में, and the epithelium is stratified squamous non-keratinized. बच्चों spots में हमेशा अच्छे slide लगाएंगे. And you can see this is a white pulp. बाकी ये सब red pulp है. And in this white pulp you have got an arteriole which is pushed to the periphery. इसका नाम है eccentric arteriole. So that's a lymph node. That's a spleen. I'm so sorry. That's a spleen. Fine है बच्चों, clear है lymphoid tissue. You should be able to identify and revise the slides. एक बार theory खत्म होता है तो when you go in the college you keep on revising the slides. जितना रिवीजन करोगे उतना it will be clear, but उसके पहले you have to know the theory part, how to identify it, how to come to a conclusion. वो याद रखना what I'm telling you, and then you see the slides. It will be easy. Fine, clear है? Okay, that's it. So subcapsular sinus is a characteristic of lymph node. So remember this. अभी चलो, come to this slide. Coming to this slide. Any guesses? What is this slide? चलो बच्चों, answer. Come on students, you can identify the slide. Come on. जो पहले आंसर कर रहे थे, you are getting confused with the skin. Skin के साथ जो confusion हो रहा था ना with the skin. Skin के लिए ऑप्शन में क्या लिखा था आपने? क्या आइडेंटिफाई किया था? Skin, thick skin. You couldn't identify it as thick skin. आपने tongue लिखा था ना, tongue. This is tongue. This is how the tongue is. These are the papillae. These are the papillae. And tongue में देखो, tongue में there'll be plenty of skeletal muscles. तो पहले तो skeletal muscles बहुत सारे दिखेंगे. Now you know how to identify the skeletal muscles. Nucleus is at the periphery. Fine. Yes, that is finally the tongue. So nucleus is at the periphery, and then you get plenty of skeletal muscles. वो skin में there was connective tissue, बच्चों उसमें muscle नहीं था. प्लस यू गेट पैपिले, हाँ, फिलीफॉर्म, फंगीफॉर्म, सर्कमवैलेट, टेस्ट बर्ड्स मिलेंगे सर्कमवैलेट पैपिले में. हाँ, माय एम इज टू हेल्प यू टू आइडेंटिफाई द स्लाइड. फाइन, सो दैट इज अबाउट द टंग. ओके, ये है पैपिले. लुक एट दिस पैपिले, एंड यू गेट प्लेंटी ऑफ मसल्स हियर. हाँ, दीज आर द पैपिले एंड द मसल्स. वॉन एबनर्स ग्लैंड्स, यस, वॉन एबनर्स ग्लैंड्स में मिलते हैं. Look at this beautiful slide, बच्चों. This is a standard slide. Huh? This is a standard slide. You should be able to identify this. बोल सकते हो क्या है ये? That's fine, Indu. That's fine. Look, this is what I was telling you. ये मैं बोल रहा था आपको. Skin को दूसरा ऑप्शन आपने क्या लिखा था? एक तो टंग लिखा था. Which was the second option that you had written for the skin? That is this slide. Yes, come on, students. Can you identify this? This is esophagus. Very good. ये है esophagus. This is esophagus. अभी देखो esophagus कैसे आइडेंटिफाई करोगे? GIT है, GIT. 4 layers of GIT. You should know this. अगर GIT का स्लाइड आता है, examiner is going to ask you what are the 4 layers of GIT. हाँ, so 4 layers of GIT: mucosa, submucosa, muscularis externa, serosa. Mucosa, submucosa, muscularis externa, serosa. Mucosa is made up of epithelium, lamina propria, and muscularis mucosa. Epithelium, lamina propria, muscularis mucosa. Fine. So this is a general standard plan of GIT. Now coming to the esophagus. What is the epithelium of esophagus? This is stratified squamous non-keratinized epithelium. And there will be glands here. This is the submucosal glands. Submucosal glands. So stratified squamous non-keratinized epithelium and submucosal glands. This is 100% esophagus. Yes, Nandini. करता हूँ. Fine, बच्चों. So esophagus clear है. Now we are going towards GIT. GIT. Look at this slide. ये है ना थोड़ा सा डिफिकल्ट स्लाइड होता है बच्चों को आइडेंटिफाई करने को. स्टूडेंट्स फाइंड दिस स्लाइड डिफिकल्ट टू आइडेंटिफाई. नाउ हाउ डू यू आइडेंटिफाई दिस? 4 layers of GIT दिखते हैं. Then you see this simple columnar epithelium. Simple columnar epithelium. Then when pits are less deep. Pits are less deep, and this is a colorful slide. इसमें chief cells होता है, parietal cells होता है, chief cells, parietal cells होता है. So this slide looks a beautiful, colorful slide. This is, yes, Ashish. This is the fundus of the stomach. Fundus of the stomach. Simple columnar epithelium है and a colorful slide because chief cells, parietal cells होते हैं, तो it looks a very colorful slides. Gastric pits are less deep. So this is fundus of the stomach. Very good. ये है fundus of the stomach. If you compare it with this, look at this slide, बच्चों. The gastric pits are deep. ये देखो, the gastric pits are deep, deep, deep. And this is a less colorful slide as compared to fundus. This is pylorus. Nandini, बोलता हूँ Nandini, just wait. So this is the pylorus of the stomach. हाँ, stomach में ना students make mistake. स्टमक के स्लाइड में गलती करते हैं. फंडस एंड पाइलोरिस. हाँ, फंडस में कैसे याद रखोगे? सिंपल कॉलमनर एपिथेलियम, गैस्ट्रिक पिट्स आर शैलो, लेस डीप. हाँ, फाइन, यस. इसमें गैस्ट्रिक पिट्स आर डीपर. फाइन. सो स्टमक एंड पाइलोरिस, ये याद रखना. Now, बच्चों, can you tell me this? Look at this, finger-like projections, finger-like projections, finger-like projections. What do you feel is this? Finger-like projections, क्या है, क्या होगा ये? The moment you see finger-like projections, this is villus. Villus. ठीक है, मतलब इसोफेगस आप आइडेंटिफाई कर सकते हो, स्ट्रैटिफाइड स्क्वामस नॉन केराटिनस एपिथेलियम, सबम्यूकोसल ग्लैंड्स. यू कैन आइडेंटिफाई विलिस. हाँ, गॉबलेट सेल इंक्रीजेस, क्रिश गॉबलेट सेल इंक्रीजेस, जैसे नीचे जाते हो गॉबलेट सेल इंक्रीजेस, यस इंक्रीज होते हैं. लार्जेस्ट, plenty of goblet cells in the large intestine, plenty of goblet cells in the large intestine. Fine. So you find this villus. हाँ ठीक है बच्चा, तो अभी देखो you have villus, the small intestine. What do you see? Villus. So villus with Brunner's glands. Brunner's glands. So what is this? This is duodenum. Villus with pairs patches. Pairs patches. So that is ileum. And villus with nothing specific. There's nothing there. So that is ileum. That is jejunum. That's jejunum. That's a very, very easy way to identify this. Very easy way to identify this. Okay. So ये क्या होगा? Where is this? In the submucosa. Submucosa. मतलब villus दिख रहा है, villus है मतलब 100% it is small intestine. Now how do you differentiate whether it's duodenum, jejunum or ileum? Fine. So अगर वो duodenum है तो look, beautiful Brunner's glands. ये देखो, these are the Brunner's glands. पेपर 1 डिफिकल्ट था तो बच्चों हैव होप्स पेपर 2 विल बी इजी. हाँ, पेपर 2 इजी होगा. हाँ, पेपर को बैलेंस किया जाता है वैसे. सो डोंट वरी, बी फोकस्ड, बी फोकस्ड. ठीक है बच्चा. सो विलस देख रहे हो, विलस, एंड यू सी दिस ब्रूनस ग्लैंड्स. अभी कभी कभी कंफ्यूजन होता है. हाँ, कभी कभी कंफ्यूजन होता है. दिस इज ईसोफेगस. अब व्हाई इज दिस नॉट ईसोफेगस? नंबर 1, विलस दिखता है. विलस दिखता है मतलब 100% ईसोफेगस नहीं है. Esophagus में epithelium is stratified squamous, non-keratinized epithelium. Fine. Okay. यही पूछेंगे डिस्कशन में, यही पूछते हैं डिस्कशन में बच्चों. आदित्य, this is what is asked. बोलता हूँ क्रिप्स ऑफ ल्यूबरकुन बोलता हूँ. ओके फाइन. क्रिप्स ऑफ ल्यूबरकुन आर प्रेजेंट इन द स्मॉल इंटेस्टाइन्स. हाँ, वो डिप्रेशन होता है, डिप्रेशन दैट इज नोन एज क्रिप्स ऑफ ल्यूबरकुन, जिसमें पैनेट सेल्स होता है, लाइसोजाइम होता है. हाँ, लाइसोजाइमल सेल्स, पैनेट सेल्स, रीचा. These are present in small and large intestines. Crypts of lubricants. Depressions between the cells, between the between the villus. Fine. Okay. Now look at this. Look at this. So this is villus, and what is this? ये क्या है? This is a lymphoid follicle. That is pairs patches. Okay. So that is lymphoid follicles. That is pairs patches. So that is ileum. Ileum. And villus with nothing specific. There's nothing. No Brunner's glands, no lymphoid follicles. So this is going to be the jejunum. Jejunum. Fine, bachcho. Can you identify a slide of small intestines? The moment you see villus, it is small intestine. That's how you identify. Then so go for duodenum, jejunum, and ileum. Fine. ठीक है बच्चों? Clear है? Okay. Hi, Bantu. Fine. Now coming to this, look at this slide. Something very important. Students है ना इसमें गलती करते हैं. Students make mistake in this. Now look at this slide. What do I find? I find empty. पूरा empty दिखता है. Everything is empty, right? So what are these empty cells? Empty cells are the mucus secreting cells. These are the goblet cells. And this mucus secreting cells, when we stain, जब ये अपन stain करते हैं, the mucus gets dissolved, it looks empty. So plenty of goblet cells. That has to be large intestine. That has to be large intestine. Very good. Clear? Large intestine. Jejunum नहीं है बच्चे, villus नहीं है ना. There's no villus. Villus नहीं है मतलब it's not small intestine. Only goblet cells. Simple columnar epithelium with goblet cells. Plenty of goblet cells. That is large intestine. And if you have this goblet cells with lymphoid follicles, that is going to be appendix. Goblet cells with lymphoid follicles, that is appendix. Fine. Clear hai? So GIT you can identify now. Esophagus, stratified squamous non-keratinous epithelium, submucosal glands. Stomach, fundus pylorus identify karna. Then you come to villus, small intestines, then large intestine, plenty of goblet cells. Hi, good evening. Lymphoid follicles, then it's appendix. Very good. Hi, Anupama. Hi. Okay. Now come to this slide. Can anyone tell me what is this slide? Oh, beautiful slide. This is beautiful slide. अगर ये slide आता है, I'm very happy. What is this? A standard slide, a very standard slide. What do you think is this? Huh? Any guesses? Any guesses? You can see this structure and you can see the cells which are radiating. Cells जो radiate हो रहे हैं, radiate हो रहे हैं, radiate हो रहे हैं, radiate हो रहे हैं. What is this slide? Liver. Very good. That's liver. Hey, liver is something that you should know. Huh? This is liver. Yes. So you get this central vein. ये central vein है, and this is the portal triad. So ये ना ऐसे you get a you will get a hexagon. हाँ, इसमें दिख नहीं रहा अच्छे से. So this is the portal triad. These are the hepatocytes. Hepatocytes के बीच में sinusoids होता है. Liver is very easy to identify. हाँ, very easy. नहीं, MEHS के easy होते हैं. Easy होते हैं बच्चे. MEHS, it's not that difficult. You should be confident. Nothing is difficult. Okay, that's liver. Look, central vein है, and then periphery पे portal triads होते हैं. बाकी you have to know the details. हाँ, what is a classical hepatic lobule, liver acinus of Rappaport? वो एक बार देख लो. Fine. Coming to this slide. Yes, can you identify this slide? This slide. If I see this, I find serous acinus. Huh? अगर मैं इतना ही देखता हूँ, so I think this is serous acinus. But the moment I see this, what is this? This is pancreas. Very good. This is pancreas. So this is the exocrine part of the pancreas. ये है exocrine part of the pancreas, and the exocrine part of the pancreas resembles what? ये क्या resemble करता है? A serous salivary gland. So you have to be very careful. You have to search in the slide. आपको slide में search करना है, and अगर आपको ये islets दिखते हैं, if you are able to see the islets, this is pancreas. Perfect. So serous exocrine part is a serous salivary gland. Endocrine part is islets of Langerhans. That's how you identify the pancreas. Very very important slide. Liver, pancreas, ये सब बहुत important slides हैं. हाँ, fine. Okay, now coming to this again. हाँ, very good. अब बच्चे ना इसको क्या लिखते हैं पता है? If I put this in the spots, ये मैं spots में रखा. Students write this as hyaline cartilage and come out. Students write this as hyaline cartilage. What do you think? What do you think? क्या लगता है आपको? Hyaline cartilage है. Yes, that's fine. Hyaline cartilage है, but see, look at this. Look at this also. This is pseudostratified ciliated columnar epithelium with stereocilia. So pseudostratified ciliated columnar epithelium दिखता है, hyaline cartilage दिखता है. So this has to be trachea. If you write it as hyaline cartilage, you get half marks. आधे marks मिलेंगे. Fine. If it is only hyaline cartilage, तो then you write it as hyaline cartilage. But hyaline cartilage के साथ अगर ये दिखता है pseudostratified ciliated columnar epithelium with stereocilia, that has to be trachea. And you'll get trachealis muscle, you'll get glands. Glands भी मिलते हैं, trachealis muscle भी मिलता है. Fine. So this is it. So this is another slide of trachea. Same है. Hyaline cartilage, you can see glands here. This is the epithelium and trachealis muscle भी मिलता है. Fine. Pseudostratified ciliated columnar epithelium with goblet cells. Pseudostratified ciliated, stereocilia नहीं है अक्षर. It is pseudostratified ciliated columnar epithelium with goblet cells. That is respiratory epithelium. You should know this. There's no stereocilia. अगर है भी तो बहुत कम होते हैं. Oh, this is the slide that you all were waiting for. This is the slide that you all were waiting for. Look at this. Look at this big air spaces. Look at this बड़े air spaces. देख रहे हो? This is the lung. ये है lung. अब you were getting confused between what? The mucus acinus and this. अब clear है? Mucus acinus छोटे होते हैं. They are very small mucus acinus which looks empty. Now this are big air spaces. This is the lung, alveolus. Fine. So simple squamous epithelium वगैरह वो सब आना चाहिए. Fine. Clear बच्चों? Okay. Now coming to this slide, another very standard slide, बहुत ज़्यादा important slide है. This is considered to be an easy slide for identification. बोल सकते हैं what is this? Any guesses? What is this? हाँ, you can spot, मतलब ऐसे identify करना चाहिए this slide. Any guesses? You can see here also. Guess. ऐसे सब slide एक साथ आ जाते हैं ना, so that then you should be able to identify and guess this. Yes, what is? This is seminiferous tubule. This is testis. Excellent, very good. Hi Sagar, hi. This is the seminiferous tubule. This is a slide of testis. Testis is very important, a very important slide. And in this seminiferous tubule, there are different stages of developing sperms. Different stages of developing sperms. Okay, spermatogonia, for type A, type B, spermatocytes, and then sperms. So seminiferous tubule, बीच में Sertoli cell होता है, and then in between the seminiferous tubules you have got interstitial cells of Leydig. वो theoretical है. जो दिखेगा आपको, you will be seeing seminiferous tubules, and in the seminiferous tubules you will be seeing different stages of developing sperms. Fine. Hi Sagar. Fine. Okay. Clear? So seminiferous testis is another very important slide. ये क्या है? ये इसमें students find a problem. Hi Sagar, I understood. Fine. Just listen here. What is this slide? Any guesses? ये थोड़ा सा difficult लगता है बच्चों को identify करने को. Yes. Embryology भी है बच्चे, embryology भी है. What is this? What do you think is this? This is epididymis. Epididymis, it is columnar epithelium with stereocilia. Columnar epithelium with stereocilia, and you get this collection of sperms in the epididymis. ये थोड़ा सा difficult होता है बच्चों को identify करने को. Look, that is columnar epithelium with stereocilia, and this is the collection of sperms. That is epididymis. Come on students, this is a very important slide. One of the slide with lumen. एक था blood vessel, दूसरा था vas deferens, तीसरा था ureter, चौथा था fallopian tubes. What is this? Look at this. You can see this, a thick muscle coat, बहुत ज़्यादा muscle coat होता है, and the epithelium is again columnar with stereocilia. Pseudostratified columnar with stereocilia. What is this slide? बहुत छोटा सा ल्यूमन दिखता है ना, big muscle coat. This is the vas deferens, ductus deferens. vas deferens. Ureter नहीं है बच्चे, ureter में star shaped lumen है, ovary नहीं है. Ovary में you see different stages of developing follicles दिखता है ovary में. Ovary is very easy to identify. Ovary बहुत easy है. Fine. Is this clear? Fine. See, this is how the vas deferens looks. The lumen is very small. Epithelium is pseudostratified, columnar with stereocilia, and a thick muscle coat. Okay, that's vas deferens. Identify this. This is another very important slide. बहुत important slide है ये. You can see this glands here. ये देखो, this glands you can see, and the glands are involuted. क्या लगता है ये? Glands ऐसे folded होते हैं. Glandular tissue होता है, fibrous tissue होता है, muscular tissue होता है. You get fibromusculoglandular organ. What is this? Come on, can you guess this? A fibromusculoglandular organ. Yes, that is prostate. Very good, Manas, Akshat. Yes, this is prostate. Prostate कैसे identify करोगे ना? You get glands like this, and glands are folded. ऐसे folded होते हैं, folded on itself. इसको बोलते हैं involution. That is known as involution, and inside you get its secretions known as corpora amylaceae. Those secretions. Fine. So that's how you identify the prostate. But out of 10 spots, if you get 10, it's well and good. But at least 7 you have to get it right. 7 minimum आना चाहिए to score good marks. Okay, look at this now. What do you think is this slide? A very easy slide. This जैसे lung है, very easy. This is very easy. Hyaline cartilage, very easy slide. What is this? Any guesses? See, this is cortex. ये cortex है, ये medulla है, cortex medulla. In the cortex you get different stages of follicles. Yes, that's ovary. That's ovary. Very easy slide. And this is a Graafian follicle. ये Graafian follicle दिखता है. So this is the cortex. That's the medulla. Medulla has lymphoid follicles, blood vessels, lymphatics. Medulla में the cortex has different stages of growing follicles. Fine. What is the epithelium? Germinal epithelium is simple cuboidal. Simple cuboidal. That is germinal epithelium. Look at this. Another slide with a lumen. Another slide with a lumen. Lumen thoda sa large hai, but you find like this. Look at this. Look at this. The lumen is folded. The lumen is thrown into folds. ऐसे folded lumen होता है. What do you think is this? Look at this slide. This is the diagrammatic representation. Lumen is thrown into folds for nourishment of the ovum. Nourishment of the ovum. What do you think is this? Guess कर सकते हो. That's fallopian tubes. Fallopian tubes. Slide with a lumen. याद रखना. छोटा सा lumen. Pseudo-stratified columnar with stereocilia. Thick muscle coat. That's vast difference. The lumen is folded, and simple columnar epithelium with cilia. Ciliated columnar epithelium. This is fallopian tubes. Fallopian tubes. Fine. Okay. Very good. See, that's how the lumen looks. The lumen is folded. हाँ, ये fallopian tube है. For the nourishment of ovum. Fine. Okay. What is this? Can you identify this slide? ये थोड़ा सा primitive है, but क्या लगता है? What do you think? अभी flow में जा रहे हैं तो you should be able to identify this slide. Okay. Not a very good slide. A primitive मतलब animal का slide है ये, not a very good slide. But I can see glands here. बहुत सारे glands दिखते हैं. And the muscles are not that developed. This is uterus. ये uterus है बच्चा. Uterus है. But not so good. Not a good slide. ये uterus है. Fine बच्चे. ये क्या होगा? अगर कॉलेज में दिखाया है तो ये देख लो. This is mammary gland. Mammary gland. ये क्या है? इसमें देखो ducts. इसमें the ducts are less, the ducts are more, the ducts are ज़्यादा developed है. So this is a active mammary gland. This is a passive mammary gland. Passive mammary gland. Fine. We'll come to this. ये slide देख लो. चलो बोलो. What do you think is this? This is one of the easiest slide. बहुत easy slide है ये. The moment I see this, I should be able to identify. जैसे मैं ये दिखता हूँ, I should be able to identify this slide. Come on, students, can you identify this? हाँ, बोलो. Any guesses? That's a kidney. हाँ, kidney. So you can see this glomerulus. हाँ, this is the Bowman's capsule. फिर PCT, DCT, cortex medulla. A lining epithelium of PCT, simple cuboidal with brush border. DCT, simple cuboidal without brush border. Loop of Henle, simple squamous epithelium. हाँ, ये सब different types of epithelium आना चाहिए. Fine, that's about the kidney. Look at this slide. बहुत ज़्यादा muscles होते हैं. So बहुत ज़्यादा muscles होता है ना. Which slide do you get this? बहुत ज़्यादा muscles. Number 1 is this slide. Number 2 is uterus. Uterus में भी बहुत ज़्यादा muscles मिलते हैं. Tongue में भी बहुत ज़्यादा muscles मिलते हैं. But tongue, uterus, and this is the urinary bladder. ये bladder है. Plenty of muscles. हाँ. But tongue कैसे identify करोगे? You get skeletal muscles in the tongue and you get papillae. So papillae with muscles, that is tongue. Fine. In uterus, you get plenty of smooth muscles with glands. Glands होता है, smooth muscles होता है. So that is the uterus. इसमें smooth muscles होता है, plus the epithelium is transitional. Plenty of smooth muscles. This is urinary bladder. This is going to be the urinary bladder. Yes. ठीक है? Yes. Tongue में skeletal muscles you have got. Clear to all of you? Okay. Fine. Identify this slide. You can see this. Yes, I am talking in English only. What is this? ये क्या है? What is this? Yes, come on. What is this? क्या लगता है ये? What is this? A star-shaped lumen. हाँ, star-shaped lumen. Yes, star-shaped lumen with transitional epithelium. क्या लगता है? What do you think is this? Ureter. Ureter. ठीक है, तो slide with lumen clear है. Number 1 is blood vessel, artery. You can identify 3 tunics. Number 2 is vas deferens. Number 3 is ureter. And number 4 is fallopian tubes. ये 4 slide है जिसमें lumen दिखेगा. Clear? You should be able to differentiate star-shaped lumen, transitional epithelium. So that is going to be a ureter. Perfect. Okay, great. This is a very easy slide. Chalo bachcho, bolo. If you get this slide, nothing like it. Yes. Come on, students, come on. Next slide will be thyroid gland. Yes, so this is the thyroid gland. अगर ये slide आता है, nothing like it. Simple cuboidal epithelium, thyroid follicles are seen. Follicles में the colloid is seen. Colloid, fine. Very easy slide, thyroid. Okay, great. Can you identify this slide? Yeah, ना ये difficult slide है. This slide, students find it very difficult. But look at this zone. ये जो zone है, इसमें you find colorful cells, acidophilic cells, basophilic cells. इसमें you find pale nerve fibers. Nerve fibers होते हैं यहाँ पे, इसमें acidophils, basophils होता है. And this is pars intermedia, जहाँ पे you get colloid-filled vesicles. Colloid-filled vesicles similar to thyroid. ये देखो. तो स्टूडेंट्स क्या करते हैं ना, स्टूडेंट्स लुक एट दिस एंड आइडेंटिफाई इट एज थायराइड. दिस इज रॉन्ग. नो, दिस इज पिट्यूटरी. ये पिट्यूटरी है. दिस इज पार्स एंटीरियर जिसमें क्रोमोफोर्स, क्रोमोफिल्स होते हैं, एसिडोफिल्स, बेसोफिल्स. दिस इज पोस्टीरियर पिट्यूटरी जिसमें नर्व फाइबर्स होते हैं. एंड दिस इज पार्स इंटरमीडिया जिसमें देयर आर कोलॉइड फिल्ड वेसिकल्स. यू कैन सी वन ऑफ देम हियर. दैट्स कोलॉइड फिल्ड वेसिकल. ओके स्टूडेंट्स, ये colloid filled vesicle वो देखते हैं, they write it as thyroid. हाँ, so pituitary is a difficult slide to identify. हाँ, it is coming in the difficult. Okay, अभी ये है ना, this slide is slightly difficult. Another very difficult slide to identify is adrenal gland. Adrenal gland थोड़ा सा difficult होता है. तो this is a capsule. ये आप capsule देख रहे हो, capsule. Then first layer you get umbrella shaped cells. ये जो देख रहे हो umbrella shaped cells. What is this? Zona glomerulosa. Then you get straight cells. Not very clear. This is zona fasciculata. And then what is this? They merge. That is reticularis. Reticularis. Fine. So zona glomerulosa, fasciculata, reticularis. So this is a slide of adrenal gland. थोड़ा सा difficult है. ये pituitary and adrenal, you have to revise it. This is another difficult slide. Bachcho, can you tell me what is this? But we are coming to an end of the slides. Yes, Bolo, what do you think is this slide? ये बहुत बच्चे गलत करते हैं इसमें. बहुत बच्चे इसमें गलत करते हैं. This slide, nothing is seen. Only ये ऐसे है ना, गोल 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 दिखता है, या फिर you see this triangles like this triangular cells, and you get the largest size of triangular cells which are known as bed cells. What is this? This is cerebellum नहीं है बच्चे. This is cerebral cortex. Cerebral cortex. pyramidal cells. This is cerebral cortex. Cerebellum में किधर है pyramidal cells? अक्षत. This is cerebral cortex. Fine. Okay, cerebral cortex. So 6 layers of cerebral cortex याद रखना. 6 layers of cerebral cortex. Now what is this slide? ये देखो, this slide. Mohammed, Akshat, what is this slide? This is a slide of cerebellum. This is molecular layer, this is granular layer, and यहाँ पे होता है Purkinje cell layer. So outer molecular, inner granular, and then you get the layers of Purkinje cell which are flash-shaped cell. So this is the slide of cerebellum. Yes, cerebellum is very important slide. Cerebellum is very important slide. Fine. So cerebral cortex difficult slide है. Cerebellum is easy. Look at this, another easy slide. So this is molecular layer, Purkinje cell layer, and granular layer. Fine. Identify this slide. ये भी slide आता है, बहुत बार आता है ये slide. So what do you have this slide? This is The first is epithelium, that is simple cuboidal epithelium. Then you have this Bowman's membrane, फिर substantia propria. Then you have got this Descemet's membrane and endothelium. What is this slide of? This slide of very important slide, very important slide. Collagen fibers होता है, fibroblast होता है. Hi. Cornea. Cornea याद रखना. Cornea is a very important slide. हाँ, cornea. Layers of cornea याद रखना. Epithelium, Bowman's membrane, substantia propria, Descemet's membrane, and endothelium. Fine. So slide of cornea. This are the slides. And this is a very easy slide to identify. ये कोई भी identify कर सकता है. 10 layers. That's a, ये आया तो बहुत easy है. That's a slide of retina. Slide of retina. Fine. So this much you can identify. Just remember those layers. चलो, we come to this now. Tell me. अभी ये देख लो, कुछ models हैं. There are some models here. Okay. Now tell me. I'll just point out. You tell me what is this? What is this? This is a folding of embryo. ये folding of embryo है. Can anyone tell me what is this? हाँ, चलो बच्चों, we answer this fast. Hi Aditya, fine. What is that? And what is this structure? ये क्या है? चलो बच्चों बोलो. ये ना एम्ब्रियो के स्लाइड्स. योर एम्ब्रियोलॉजी हैज टू बी परफेक्ट. अभी थ्योरी दे रहे हो तो एम्ब्रियो अच्छे से पढ़ना. द मॉडल्स विल बी इजी टू अंडरस्टैंड. दैट्स अ फोल्डिंग ऑफ एम्ब्रियो. दिस इज द सेप्टम. यहाँ पे होगा सेप्टम ट्रांसवर्सम. दैट्स अ डेवलपिंग हार्ट. दिस इज द प्रोकॉर्डल प्लेट. दैट्स अ न्यूरल ट्यूब. दिस इज द योल्क सैक. व्हाट इज दिस नोन एज? हाँ, तो ये है एलेंटॉइस. एक मिनट. This is the allantois. ये देख रहे हो? That's the allantois or urachus. And what is this structure? That's the connecting stalk. ये है connecting stalk. हाँ नंदिनी, करता हूँ for BPTHB कुछ करता हूँ. Fine. So this is allantois. What is allantois? It's in fetal life एक connection होता है between the umbilicus and the urinary bladder, जिसको हम बोलते हैं allantois. After birth it degenerates off. उसका बनता है median umbilical ligament. अगर वो obliterate नहीं हुआ तो that is weeping umbilicus. Fine. What is this? This is the vitelo-intestinal duct or the vitelline duct. That's a vitelline duct or the vitelo-intestinal duct, connection of the midgut with the yolk sac. Then fistula, Meckel's diverticulum, सब कुछ इसके साथ आता है. वाइवा कैन गो एनीवेयर. जैसे आप आंसर करोगे वैसे वाइवा जाएगा. ठीक है, जितना आंसर करते हो उतना दूर वाइवा जाएगा. अंडरस्टूड? फाइन. नाउ यू टेल मी व्हाट इज दिस? That's a villus. Then you have to know what is the primary villus. Syncytial trophoblast, cytotrophoblast. That's a primary villus. What is the secondary villus? Syncytial, cyto, and extraembryonic mesoderm. That's a secondary villus. And what is the tertiary villus? Syncytial, cyto, mesoderm, and blood vessels. That's a tertiary villus. हाँ, ये याद रखना. So this is the yolk sac. That's an amniotic cavity. Yolk sac, amniotic cavity. Fine. What is this? ये क्या लगता है? ये क्या है? चलो बच्चों, आंसर नाउ. Just answer. What do you think is this and what do you think is this? चलो, answer this. Any guesses? ये प्रैक्टिकल्स के लिए बहुत इंपॉर्टेंट है. This is placenta. Yes, be confident. This is placenta. What is this aspect? ये कहाँ से देख रहे हो and ये कहाँ से देख रहे हो? Now you tell me. What are these two different views of placenta? बोल सकते हो? This is the fetal side of placenta. That's a fetal side. That's an umbilical cord. ये है fetal side of placenta. You can see the blood vessels. And what is this? This is the maternal side of placenta. ये है cotyledons. याद है ना cotyledons? वो villus ऐसे अंदर जाते हैं and they divide the placenta into cotyledons. So this is the maternal side of placenta, जो mother के side पे है, maternal side, and this is the fetal side of placenta. ठीक है? yes. Then functions of placenta वगैरह वो पूछते हैं, right? What is this? That's a villus. Primary, secondary, tertiary villus याद रखना. I just told you what is primary, secondary and tertiary villus. Can anyone tell me what is this? ये क्या है? What can this be model be of? ये किसका मॉडल है? See here, this is open here, this is open here. What is that? Formation of the neural tube. याद है neural tube? Neural tube is derived from ectoderm. Ectoderm fold हो जाता है and then it starts to close. This is the formation of neural tube. That's a closure of neural tube. The open end is known as anterior neuropore. This is known as the posterior neuropore. When does this close? 25th day. ये close होता है 28th day पे. If this does not fuse, anencephaly. If this does not fuse, spina bifida. Spina bifida. ये याद रखना. Fine, that's a neural tube. Okay, very good, very good. Fine, same hai. That's the formation of neural tube. That's a neural tube. And what are these then? These are the neural crest cells. Neural crest cells. Fine, that's okay. Chalo, answer this. What is this model showing? What is this model showing? Model, just model identify करना है आपको. Then everything is theory. फिर बाकी सब theory होता है. Come on, students, come on. Can you tell me what is this model showing? You know this, you know this. Come on. A very, very easy model. अगर ये आता है तो I'm very happy. Yes, as a student to answer. Yes. You can see this. What is this? That's a septum spurium. Septum spurium. And this is the formation of development of heart nahi hai. Development of heart nahi. It is the development of interatrial septum. Interatrial septum. This is the development of interatrial septum. ये देखो, ये देखो, ये देखो. हाँ? That is foramen ovale. Foramen ovale. So interatrial septum अगर पूछते then you can answer no septum primum, then septum secundum, foramen primum, foramen secundum, and foramen ovale. ये सब आना चाहिए. Fine. What is this model? What is this model? Come on, come on, come on, बच्चों. This is the development of interventricular septum. बस मॉडल आइडेंटिफाई करना है. Then you have to answer on theory. This is interventricular septum. Interventricular septum, muscular part, membranous part. Muscular part grows in the floor of the ventricle. Membranous part is derived from one, the bulbar septum, and the development and the proliferation of AV cushions. Proliferation of AV cushions. Fine. So that's the development of interventricular septum. This is interatrial septum. This is AV cushion. ये AV cushion है. Fine. Okay. What is this development of? This is very important. This you should know. Yes. What is this development of? And फिर बाकी सब theory होता है. हाँ, वो लिखा होता है development of arterial arches. Development of arterial arches. इसमें you have to know how many arterial arches are there. What is this artery? बोल सकते हो what is this artery? This is the pulmonary artery. Pulmonary artery is derived from the sixth arch artery. What is this? Answer this. What is this? Come on, बच्चों, come on. Be interactive. Come on, answer this. हाँ. What is this? ये क्या है? This is the ductus arteriosus. Ductus arteriosus. So what is ductus arteriosus? It is derived from, fine, the sixth arch artery between the lung bud and the aorta. That's ductus arteriosus. Baki, this is the common carotid. This is internal carotid. This is external carotid. हाँ? And this is the subclavian. ये arch of aorta बनेगा, ये subclavian artery बनेगा. हाँ, बाकी ductus, just read all this development of arteries. Development of arteries एक बार देख लो. Come on, students, can you tell me what is this? I'll label this as A. I'll label this as B. I'll label this as C. Come on, answer this. What is A, B, and C? Easy है, easy है, come on. foregut is fine. Richa, what is A, what is B, and what is C? Hi, San. I'm fine, I'm fine. That is dorsal and ventral pancreatic bud. This is the dorsal pancreatic bud. That's a ventral pancreatic bud. This is the hepatic diverticulum. This is the cystic diverticulum. Hepatic diverticulum, cystic diverticulum. That's a dorsal and that's a ventral bud. Ventral bud पीछे से जाएगा. It will go from backside. It will join with the dorsal bud. फिर dorsal bud से क्या बनता है? Ventral bud से क्या बनता है? You have to know. You have to know what is annular pancreas. Annular pancreas occurs due to defective migration of ventral pancreatic bud. What is pancreatic divisum? अगर ये दोनों बर्ड्स फ्यूज नहीं हुए सो यू गेट पैंक्रेटिक डिविजम. ओके, सो दिस इज व्हाट इज आस्क्ड इन दिस. ये सब थ्योरी है, एंटायर थिंग इज थ्योरी. कम ऑन बच्चों, यू टेल मी व्हाट इज दिस. व्हाट इज दिस ए एंड व्हाट इज दिस बी. कम ऑन, इफ यू कैन आंसर दिस. आई हैव ड्रॉन दिस. ये मैंने बोला आपको. व्हाट इज दिस सी. हेलो हेलो, हाय हेलो. बोल सकते हो. दिस इज वेंट्रल मीसोगैस्ट्रियम. दिस इज वेंट्रल मीसोगैस्ट्रियम. दैट्स डॉर्सल मीसोगैस्ट्रियम. दैट्स अ स्टमक. दिस इज द लीवर. ये लीवर बन गया वेंट्रल मीसोगैस्ट्रियम में. दिस इज द स्प्लीन. ये स्प्लीन बन गया डॉर्सल मीसोगैस्ट्रियम में. द डॉर्सल मीसोगैस्ट्रियम गेट्स डिवाइडेड इनटू. दिस बिकम्स, ये बन गया गैस्ट्रोस्प्लेनिक. ये बन गया लाइनोरीनल लिगामेंट एंड ये बन गया अपना लेसर सैक. लेसर सैक. So these are the derivatives of the ventral and dorsal mesogastrium. Derivatives of ventral and dorsal mesogastrium. ठीक है. जो मॉडल्स आपके कॉलेज में है ना वो देख लो. आई एम जस्ट शोइंग यू द कॉमन मॉडल्स. जो कॉमन मॉडल्स है वो मैं दिखा रहा हूँ आपको. फाइन. गैस्ट्रोस्प्लेनिक, लाइनोरीनल लिगामेंट, उनके कंटेंट्स पूछते हैं. दे आस्क द कंटेंट्स. फाइन. दिस इज रोटेशन ऑफ गट. हाँ, ये रोटेशन ऑफ गट है. रोटेशन ऑफ गट याद है ना. हाउ मेनी डिग्रीज ऑफ रोटेशन डज अ मिड गट अंडरगो. मिडगट कितना रोटेट होता है? हाउ मेनी डिग्रीज ऑफ रोटेशन डज अ मिडगट अंडरगो? एनी गेसेस? आंसर. 3 रोटेशंस ऑफ 90 ईच. सो कितना हो गया? 270 डिग्रीज ऑफ रोटेशन. 270 डिग्रीज ऑफ रोटेशन अ मिडगट अंडरगोस. फाइन. तो ये सब पढ़ लो. जस्ट गो थ्रू दिस रोटेशन ऑफ गट. दिस यू हैव टू नो. फाइन. ओके, फाइन. द सेम. Come on, बच्चों. Identify this A, identify this B, identify this C. This is the aorta. ये है अपना aorta. See, this is a beautiful model. बहुत अच्छा मॉडल है ये. This is a beautiful model. ये foregut है, ये midgut है, ये hindgut है. So ये aorta है. These are the ventral branches of abdominal aorta. This is the celiac trunk. That's the superior mesenteric artery. That's the inferior mesenteric artery. This is the loop of midgut. हाँ, एंड दैट फिर रोटेशन होता है. द सुपीरियर मेसेंट्रिक आर्टरी. ये है प्री आर्टीरियल, ये है पोस्ट आर्टीरियल सेगमेंट. एंड देन यू हैव टू नो अबाउट द रोटेशन ऑफ गट. फाइन. आई एम जस्ट हेल्पिंग यू टू आइडेंटिफाई द मॉडल. ठीक है, बाकी सब थ्योरी है. यस, वेरी गुड, वेरी गुड, वेरी गुड. चिन्मयी, हाउ वाज इट? व्हाट इज दिस? दिस इज अ वेरी वेरी इंपॉर्टेंट. चलो बच्चों, बोल सकते हो. हाँ, एक्सलेंट, वेरी गुड, वेरी गुड. S.S. Mandal, very good. What is this model of? But if you can answer this, yes, come on. क्या है ये? Come on, come on, come on, come on. Then I'll ask you some questions and you rapid fire answer करिए. चलो बोलो. Any guesses? बच्चों क्या लग रहा है ये? नहीं, no. नहीं बच्चे, I've drawn a similar diagram. Very good, Chinmay. Good, no, good. This is fetal circulation. Very good, S.S. Mandal. This is fetal circulation, बच्चों. ये fetal circulation है. ये देखो ना, urinary bladder है ये. This is the urinary bladder. This is the placenta. This is the umbilical vein. This is the left umbilical vein जो placenta से जाती है liver की तरफ. This is the ductus venosus. Ductus venosus. हाँ, फिर ये heart में गया. फिर वो fetal circulation, you know. And then फिर ये aorta है. ये internal iliac. What is this artery? These are the umbilical arteries. Umbilical arteries are going towards the umbilicus. ठीक है. Now you tell me, after birth, this part of the umbilical arteries obliterate off. इसको क्या बोलते हो? ये bladder है, ये bladder है. bladder and umbilicus के बीच में the part of the umbilical artery obliterates off. What do you call this as? The obliterated umbilical artery. क्या बोलते हैं उसको? What do you call this as? Obliterated umbilical artery is known as the medial umbilical ligament. Medial umbilical ligament. And the non-obliterated part of umbilical artery becomes the superior vesical artery. Very good, Daniel. Sorry, very good, Nilima. Very good, very good. So this is the superior vesical artery. Fine. This is the left umbilical vein. Left umbilical vein after birth becomes the ligamentum teres. हाँ वो है ना, degenerated parts याद रखना. Degenerated parts याद रखना. It is manageable, बच्चे. It is manageable. Fine. So this is the ligamentum teres. फिर ductus venosus का ligamentum venosum बनता है. हाँ, वो सब याद रखना. Fetal circulation is very important. Theory में भी आता है ये short note. Fine. Okay, you tell me what is this? ये क्या लगता है आपको? What is this? Very good, very good. Good, good, good. All of you answering very well. बहुत अच्छी पढ़ाई की है आपने सबने. Very good. Can anyone tell me what is this? This also you know. ये आपको पता है. यहाँ पे लीवर था, यहाँ पे लीवर था. अभी बोलो. Now this will help you to identify. What is this? यहाँ पे लीवर था. Now you think and tell me. This is portal vein. Very good, very good. हाँ. So these are the two vitelline veins. ये दो vitelline veins हैं. The vitelline veins are going inside the liver and liver से ये heart की तरफ जाते हैं. Inside the liver, the vitelline veins are broken down to form the sinusoids of liver. So vitelline vein से क्या बनता है? Number one, sinusoids of liver. This part of the vitelline vein is known as the hepatocardiac channel. ये hepatocardiac channel है. ये terminal part of IVC बनाता है. And this part of the vitelline vein is going to form the portal vein. ये ना, यहाँ पे anastomosis होता है. And this is going to form the portal vein. So vitelline vein के तीन चीजें बनती है. There are three things which the vitelline vein is going to form. Number one, it forms the portal vein. Number two, it forms the hepatic sinusoids. And number three, it forms the terminal part of IVC, which is known as hepatocardiac channel. Very good. हाँ, ये सब देखा है हमने in the lectures and all. You can go through it. चलो. Now, can you tell me what is this? हाँ, ये क्या है बोल सकते हो? One moment. Okay, you tell me what is this A, what is this B, what is this C, and what is this D? Just think and answer. Think and answer. Take your time. Take your time. Take your time. Answer now. Any guesses? Yes, any guesses? सेम चीज है. अभी बोलो. सेम चीज है. Now you tell me. I made it easy. I made it easy for you. Easy कर दिया इसको. बोलो. That is the diagram which I generally draw. And this is the model. अभी correlate करो. Just try to correlate. हाँ, मतलब this entire thing A and B is the A is the urogenital sinus. A is the urogenital sinus जिससे bladder बनेगा. B is going to form the rectum and anal canal. Very good. तो ये जो yellow है ना B, that is rectum and anal canal. This entire thing is the cloaca. Cloaca ये यूरोरेक्टल सेप्टम बन गया. ये यूरोजेनिटल साइनस है. ये रेक्टम एनल कैनाल है. What is this C? What is this C? C is the mesonephric duct. Very good, very good, excellent, very good. C is the mesonephric duct. And what is this D? What is D? If you can tell me. D कौन है? D. Excellent, very good. D कौन है? D. Mesonephric duct है ना, एक bud देता है ना, and this bud is going towards the kidney. No, what is that? What is that known as? What is that D known as? ये कौन है? Answer. That's the ureteric bud. बच्चे ureteric bud है वो. वेरी गुड जीशान, वेरी गुड नीलिमा, एक्सलेंट। अब समझ में आया। सी ये है ना, मॉडल्स को अपने डायग्राम्स के साथ कोरिलेट करिए। वी हैव ड्रॉन ऑल दिस डायग्राम्स, सो ट्राई टू कोरिलेट। यू हैव गॉन थ्रू द बुक्स, यू हैव गॉन थ्रू द lecture notes, everything. Okay, so try to correlate this with the diagrams that you have drawn. Fine. So ये urogenital sinus है, ये rectum anal canal है, that's a part of GIT, that's a mesonephric duct, that's a ureteric bud, that's a kidney. Okay, okay, great, very good, very good. Tell me what do you think is this model? ये सब बहुत important है. This models are very important. Development of male and female reproductive system. What is this? Any guesses? Come on, बच्चों. Any guesses? This is the development of uterus. Development of uterus. These are the paramesonephric ducts. So this is the फिर है ना, हाँ. So then you have to know the fate of mesonephric duct, fate of paramesonephric duct. ये पूछते हैं. So paramesonephric duct, what it forms: the fundus body, cervix, upper 1/3 of the vagina, lower 2/3 of the vagina is derived from sino-vaginal bulbs. ये याद रखना. Yes. And then what is the fate of paramesonephric duct in males? Appendix of testis and prostatic utricle. ये याद रखना. Now this is the development of external genitals. External genitals. What is this known as? What is this A? This is known as the genital tubercle. This is the genital tubercle. What is this? This are the genital swellings. कहाँ गए वो? Genital swellings. And this are the genital folds. So then you have to know what is the genital tubercle form. हाँ बच्चे, yes, BPTH को ये embryo नहीं है. You don't have this embryology. Fine. So what is the genital tubercle form? Males में penis, females में clitoris. What is the genital swellings form? Males में scrotum, females में labia majora. And what is the genital fold forms? Labia minora in females and the ventral aspect of penis in males. So this is the development of external genitalia. External genitalia. Fine. क्लियर है? कुछ डाउट्स हैं? बस 3 चीजें याद रखना है: जेनाइटल ट्यूबरकल, जेनाइटल स्वेलिंग्स, जेनाइटल फोल्ड्स. 3 things you remember. Same. Okay, tell me what is this development of? Come on, students, come on. Be interactive, come on, answer. What is this? Development of. मेटानेफ्रिक ब्लास्टिमा. वो है ना, यूरेट्रिक बड होता है ना, यूरेट्रिक बड. यूरेट्रिक बड हेल्प्स टू फॉर्म, it stimulates the metanephric blastema to form the secretory part of the kidney. मतलब वो यूरेट्रिक बड है ना, जब यूरेट्रिक बड enters the metanephric blastema, it stimulates the metanephric blastema to form the secretory part of the kidney. अगर वो नहीं होगा तो kidneys are not formed. Okay, चलो. What is this A? What is this B? What is this C? And what is this D? Answer this. What is A? A is the frontonasal process. A is frontonasal process. B is medial nasal process. C is lateral nasal process. D is mandibular process. Mandibular process. And this E is maxillary process. Very good. Clear to all of you? Fine. ये सब याद रखना. Then you understand how is the cleft lip formed, how is the cleft hair lip formed, oblique facial cleft formed. ये सब पूछते हैं. Development of face. Okay, you tell me, what is this? What is this? What is this? And what is this C? Don't look anything, don't look at the written thing. This is unilateral hair lip, non-fusion of maxillary process with the medial nasal process. This is bilateral hair lip, non-fusion of maxillary with the medial nasal process. And this is cleft palate, cleft palate. We should know development of palate, primary palate, secondary palate. Primary palate is formed by the fusion of two medial nasal process. Secondary palate is formed by the fusion of palatine process of maxilla. Fine. Cleft palate. Very good. ठीक है. Now you tell me what is this X-ray? कुछ X-rays है जो मैं दिखा रहा हूँ. हाँ, कुछ X-rays है. They might be there. If your college has shown it, it's fine. अगर दिखाया है तो they will ask you in the exams. Otherwise, they will not ask. What is this X-ray? And what is this done for? Any guesses? Any guesses? ये है uterus. देखो, this is the uterus. This are the fallopian tubes. We take a cannula through the vagina into the cervix. The dye is injected into the cervix. Hey baba, ये paranasal sinuses नहीं है बच्चे. नीलिमा, this is uterus and these are the fallopian tubes. And ये जो dye है ना, this is a special X-ray. Special X-ray. The dye is put inside the uterus. The dye will go through the fallopian tubes and the dye will go into the peritoneal cavity. ये peritoneal cavity में जाएगा. This is to see, to check the patency of the fallopian tubes. मतलब fallopian tubes block है कि नहीं. We get patients, they're not able to have children, they're not able to conceive. So we have to see whether the fallopian tubes are patent or not. Fallopian tubes proper है कि नहीं, fallopian tubes block है क्या. To see that, we do the special X-ray जिसका नाम है hysterosalpingography. That's a procedure. X-ray का नाम है hysterosalpingogram. Hysterosalpingogram. So we inject a dye in the uterus, dye fallopian tube से, it will go inside the peritoneal cavity. This is normal. ये होना चाहिए. If the dye doesn't go in the peritoneal cavity, मतलब the tubes are blocked. Fine. So why is this investigation done? To check the patency of the fallopian tubes. If a patient is pregnant, we don't do this. ठीक है ना? Students बोलते हैं, I ask when do we do this? Why do we do this investigation? So some students say, sir, to see whether the patient is pregnant or not. अगर पेशेंट प्रेग्नेंट है तो क्यों करेंगे ये इन्वेस्टिगेशन. पेशेंट प्रेग्नेंट है मतलब द फैलोपियन ट्यूब्स आर इंटैक्ट. नो अंडरस्टैंडिंग. फाइन. नो कंफ्यूजन, नो डाउट्स. सो दिस इज hysterosalpingography. that's the name of the procedure. Hysterosalpingogram is the name of the X-ray. Fine. Okay, now look at this. Look at this. अगर ये कॉलेज में दिखाया है तो पूछेंगे. हाँ. Okay, fine. You tell me what is this. So you see this calycis, you see this pelvis, you see the ureter, you see the bladder. Now this is an investigation done to see the urinary system, to check whether there's any stone, whether there's any constriction. So this is known as a pyelogram. Pyelogram is the name of the X-ray. Pyelography is the procedure. Pyelography. हाँ. तो ये minor major calyces है, ये pelvis है, ये ureter है, that's the bladder. So this is known as a pyelogram. Fine. Pyelogram. And फिर ये घड़ी है यहाँ पे. There's a watch there to see after how much time we have to take the X-rays. वो X-rays are taken at regular intervals of time. तो उतने time में dye नीचे आना चाहिए. So this is pyelogram. Pyelogram is of two types, ascending pyelogram and descending pyelogram. Ascending and descending pyelogram. Fine. Now this is there a barium है ना. Now this X-rays are not done. अभी है ना scopy आ गया ना, scopy. So we just put a scope inside and we see the interiors of stomach, intestines, the rectum, anal canal. Scopy आ गया. In the earlier days they used to do this. तो है ना barium sulfate का solution है. The patient used to drink barium sulfate. Immediately after drinking barium sulfate, अगर X-ray करते हैं तो you see the esophagus, that is known as barium swallow. बाद में the barium goes in the stomach. This is known as the barium meal. Barium meal. You can see the stomach. You can see the duodenal cap here. So this is the barium meal. You can see the rugae here, rugae है ना. So barium swallow is for esophagus. बच्चे रीचा barium swallow है ना, वो esophagus के लिए होता है. This is what we call as barium meal. You can see the gas here in the fundus. This is the duodenal cap. Yes, this is a notch. Yes, at the pylorus. Fine. So this is for the small intestines. ये small intestines दिखते हैं. So this is known as barium follow through. This is the same barium जब small intestines में जाता है. That is barium follow through. And for the large intestine, these are the large intestine. The dye is put through the rectum, through the anal canal. The dye is put. This is known as enema. Barium enema. Fine. Fine. So this is barium enema. So barium swallow is for esophagus, barium meal is for the stomach, barium follow through is for the small intestine, and this is for the large intestine. This is the barium enema. Barium enema. ये appendix भी दिखता है बहुत अच्छे से यहाँ पे. And you can see this. What is this? What is this? What is this known as? हाँ, इसका नाम क्या है? This. Answer this. Any guesses? What is that known as? Answer. That is a characteristic of large intestine. That is one of the characteristic of large intestine. What is that known as? Hostrations or saculations. Saculations एक है, एक tinea coli है, and one is hostrations, tinea coli, and third is appendix epiploicae. Appendix epiploicae. ये तीन characteristic है large intestines के. Baki, see this, you can see this blood vessels here. This one is angiography. Angiography. This is carotid angiography. ये internal carotid artery का S-shaped loop है ना ये. You can see this S-shaped loop of internal carotid artery. This is a carotid angiogram. It is not necessary that it might be kept. What is this? You tell me. ये क्या है ये? What is this? You can see this nasal septum. You can see this conchi. These are the conchi. This is the nasal septum. What is this? That's a frontal air sinus. ये frontal air sinus है. यहाँ पे maxillary air sinus देख रहे हो? That's a maxillary air sinus. This is the internal carotid artery. This is a carotid angiogram. Carotid angiogram. Fine. ये normal X-ray skull भी पूछता है. Frontal air sinus, maxillary air sinus ये सब दिखता है. हाँ, ethmoidal air sinus, sphenoidal air sinus ये दिखता है X-ray skull में. Normal X-ray skull. See this. This is again, this is the external acoustic meatus. This is the mastoid here. This is the vertebral artery. ये vertebral है, ये cervical vertebrae. That's a vertebral artery. This is a vertebral angiogram. Vertebral angiogram. नहीं. It's not important. No. आजकल बेरियम कोई करता भी नहीं है, so इतना पूछते भी नहीं है. This was done in earlier days. This is vertebral angiogram. This was carotid angiogram. Carotid angiogram. ये vertebral artery देख रहे हो. This is the cervical vertebrae, foramen transverse cerium से जा रही है, and this is the vertebral angiogram. This is a common iliacs, external and internal iliacs. This is known as the aortogram. Aortogram. This is aorta. These are the branches of the abdominal aorta. These are the two common iliacs. These are the renal arteries. Fine. Aortogram. Fine. So this is about it. जितना whatever I can, I've shown it to you. अभी bones के लिए ना बच्चों देखो bones है ना, if when it comes in the exams no, just take the bone. You have to identify the side of the bone. Identify the side of the bone. Fine. And then which side it is and why it is. Like suppose this is the humerus. So this is the humerus of right side. Why? Because the head is medial. The head is superiorly, the condyles are inferiorly, the medial and the lateral epicondyles are inferiorly. वैसे side identify करने के बाद the examiner will start directly with the questions. So I didn't see the main landmarks. मेरा एक hard parts made easy का series है PW Bedded channel पे on YouTube. It's a free series, hard parts made easy. Just have a look at that. In that I've told all important things that you have to know about the bones. Okay, we have got only 5 minutes for the X-ray, 5 minutes per student. तो 5 मिनट में वाइवा हो जाता है. Yes. Recesses है ना बच्चे, recesses है ना, recesses of the lung. एक मिनट वो है ना, एक Look, this is the heart here, ये heart है ना, and this is the lung, this is the lung here, that's a diaphragm, ये diaphragm है, ये diaphragm है. So अब ये जो recess है ना, this recess, what is this known as? What is this? And what is this recess known as? This is A and this is B. तो ये है costodiaphragmatic recess and ये है costomediastinal recess. ये costodiaphragmatic recess है. This should be angle, ऐसे angle होना चाहिए, acute angle. अगर if there's a pleural effusion, so ये ऐसे blunt हो जाता है. It becomes blunt. This recess becomes blunt. So this is the costodiaphragmatic and this is the costomediastinal recess. Fine है बच्चों. So bones पे ना, just remember the important landmarks like greater tubercle, lesser tubercle, intertubercular sulcus, femur पे भी greater, lesser trochanterus and all. So these important things you remember for the bones. That is it. Histology spots, the first thing is clinical charts that you will be able to answer. Erb's paralysis, Klumpke's paralysis के charts होते हैं, so that is easy. Second is histoslides, histospots. Histospots, try to score as maximum marks as possible. Then comes histoslide for discussion, in which suppose if you're not able to identify the slide, the examiner will help you to identify. The examiner will ask you questions and then according you get marks. फिर table grand viva शुरू होता है. Neuroanatomy is for 10 marks. So neuroanatomy has to be very clear. And you know everything now, बच्चों. Corpus callosum, sections of the brain आपको पता है. You know the ventricles, you know the fourth ventricle, है ना? तो वो सब देख लो. Internal capsule का horizontal section, वो सब देख लो. That's for 10 marks. And heart and this upper limb, lower limb, thorax, वो सब 20 mark के लिए है. And then you've got X-rays, living and bones. Fine. कुछ doubts है तो पूछो अभी. Any doubts you have, you can ask me. बोलो बच्चों, कुछ doubts है? All the very best from the entire team of PW Med students. It was very nice teaching you. I hope this FARRE series has been helpful to you and we have included practical FARRE this time specially for all of you. Okay, all the very, very best. Get good marks, get distinctions and come for interview on the PW Med channel. Okay, we'll take your interview then. Thank you so much and all the best. God bless you all. कुछ डाउट्स है किसी को तो पूछो, अदरवाइज विल स्टॉप. फाइन. एंड हैव कॉन्फिडेंस बच्चों, हैव कॉन्फिडेंस. सी इट्स टू मच, बहुत बड़ा पोर्शन है एंड everyone is scared. When I was a student like you, I also used to be scared. That is natural, that is going to happen, but be confident. You've been studying throughout and be fresh for the exams. ठीक है? So you will be able to write, see the time and adjust the answers, adjust the papers accordingly, complete your entire paper. Fine. And practicals, be confident, look into the eyes of the examiner and answer. Do not look down and answer. Look at the examiner and answer. You have to be confident, right? ये नहीं पूछते रे अक्षत, it is not asked. ये पूछते नहीं है. They don't ask this. Superficial and deep inguinal ring. Superficial inguinal ring feel करना है ना, from the scrotum you go at the base of the scrotum, you can feel the superficial inguinal ring, and deep inguinal ring is midpoint of inguinal ligament or the mid inguinal point. Mid inguinal point के ऊपर आपको जाना है थोड़ा सा, that is deep inguinal ring. Fine. Okay, we'll stop here. Thank you to all of you. It was very nice teaching you and I hope you've been benefited with all this. एक बार exams हो जाएंगे, let me know how the exams were. Fine. Thank you. We'll stop. कुछ doubts नहीं है ना किसी को? Bye bye. चलो bye. Thank you.